Thank you very much, everybody. With all the technical issues out of the way, we'll go ahead and get started with today's meeting. First of all, I'll call roll. Mr. Allen?
Here.
Dr. Freeman?
Here.
Dr. Brenzel in for Secretary Friedlander?
Present.
Representative Fugit?
Here.
Director Ingham?
Here.
Mr. Weber in for Treasurer Metcalf?
Here.
Ms. Purdy?
Here.
Dr. Roop?
Here.
Thank you. With that, we have a quorum and enough present, and we will continue on with our meeting. I'd like to first make a reference that if there's anybody in attendance who'd like to speak during the public comments, please sign up at the sheet on the podium located in the back of the room. Each person or organization will be given up to 5 minutes to speak. So if you, again, have any intent or want to speak during public comments, please make sure you've signed on the back. First order of business, I want to make sure that all the commission members have had an opportunity to review the agenda. Seeing nods of approval, yes. I'd ask for a motion to approve the agenda for today's meeting.
So moved.
Second.
Motion made by Director Ingham, seconded by Ms. Purdy. All in favor?
Aye.
Aye.
Any opposed? Seeing none opposed, the motion passes. Today's agenda is approved. Moving to the next order of business, it's an update on the business meeting schedule for the remainder of the calendar year. The next scheduled meeting of the commission is November 12th, 2024 at 1 p.m. During the new business section of this meeting, we will have some updates regarding that discussion. Next, I want to confirm that all the commission members have had an opportunity to review last month's meeting and minutes. Seeing as we have, I'd ask for a motion to approve the minutes from the last meeting.
Move for approval of the minutes.
May I have a second?
Second.
Motion made by Mr. Weber, seconded by Dr. Brenzel. Any discussions? All in favor?
Aye.
Aye.
The motion passes. Moving on to our next section for today is the Executive Director's updates. First, I want to take a moment to say a thank you to Karen Butcher, who served on this body, who has had to take on some other duties and is moving on with some other things. But we'd like to thank Ms. Butcher for her service and her time to the Commonwealth and to this effort. We appreciate her commitment and her service and dedication. So I want to make sure that we acknowledge her and thank her for her service. Next thing I just want to make a note to the commission is that a prior notification had been made about a settlement that had come to the commission, and we want to make sure to know that the Publicist Health settlement, those funds have been added to the commission funds, so there's an additional $6.8 million in the funds utilized for this commission. Another update I want to make sure to provide is previously Treasurer Metcalf had made a recommendation and asked that the commission body look to see whether or not where the funds were that the commission utilizes, what they were held, and we recognized that they were in a holding account, and based on that looked at it and moved them into an interest-bearing account, and that was done in June. And just based on that recommendation, the commission should know in the last 2 months, the 2 months of account, we have gained over $615,000 in interest for the commission to do its work. So again, that is just simply a move from one slot to another based on the recommendation of Treasurer Metcalf and a review by the body to make sure that was approvable expense. So I want to make sure that that is known. The other updates are simple ones. The registration for the Opioid Symposium, October 21st and 22nd, is now open. And we also, as people will notice and see things, we have unveiled a new logo for the commission. So you will see that as your items in the new work on the commission. That concludes all of the updates from the Executive Director. I want to move into the new business, and for that, the first order of new business is I want to welcome in Attorney General Russell Coleman, who's going to make a presentation to the Commission today. And with that, General Coleman, I open the floor to you.
Director.
From the poison of drugs and help make families and communities whole once again. A lot's happened in our shared fight against addiction since the last time I sat in this chair. We welcomed 2 new members to this body, Representative Chris Fugate and Karen Kelly. Both of these colleagues bring a valued perspective and a fire in the belly for our shared efforts. We also thank former members, Representative Danny Bentley, Carlos Cameron, and of course, Karen Butcher for their service as they departed the commission. In May, we announced a distribution of nearly 8,000 doses of naloxone to partnering organizations across the state. A second tranche, as you may know, arrived just last week, and we expect 2 more shipments of this life-saving medication later this year. In June, as you know, the commission approved the latest round of grant funding. To date, more than $55 million has flowed through this commission to combat the scourge of substance abuse. I had the opportunity to visit one of these grant recipients, DV8 Kitchen in Lexington. I saw firsthand, Director, you and I, what Rob and Diane Perez were doing in their incredible mission to help those in recovery with a stable job and a supportive community to wrap around them. I'm so grateful for the time and care that each of you put into selecting these grant recipients. I look forward to hearing more success stories like DV8 in the coming months and years to come. Also in June, we received a long-awaited report on our shared efforts. For the second straight year, overdose deaths in our Commonwealth decreased. While there's still too many families enduring the pain and the loss of addiction, it's only right that we celebrate every life saved. And at your last meeting in July, the members of this commission engaged in a robust conversation about future priorities of these grants. I came away impressed by the creativity and the passion of each of you and what you bring to this vital task. So it's fair to say there's a lot going on. Addiction is being brought out of the shadows. Those battling this demon and their loved ones have better access to treatment and support than ever before. Kentucky is finally on the leading edge of this work. We have more treatment beds per capita than any state in the nation. I spent last week with my colleagues, my friends with the KNOA, the Kentucky Narcotics Officers Association. I can tell you they are running faster to creatively go after those that are bringing this poison into our Commonwealth. Every member of this commission should take pride in the progress that we've seen. That said, we cannot and will not take our foot off the gas. It's time to be innovative, to identify the remaining gaps in Kentucky's comprehensive drug response efforts. I'm here to discuss the gaping hole in our efforts to fight the drug threat here in Kentucky. When I spoke before this commission in March, I shared my goal to build a gold standard statewide prevention initiative. We live at a time, as you know, where as little as 1 fentanyl pill can and is killing our neighbors. We live at a time where there is no margin of error. It simply does not exist. Where there's no such thing as safe, no such concept or notion of safe experimentation with narcotics. We live at a time when kilos and kilos of this poison is pouring over our porous southwest border. As you know, Kentucky is now a border state. To meet the grave challenges of our time, though, Kentucky needs a youth-focused effort that will keep our sons and daughters away from this poison in the first place. Our office and the commission staff has zealously collaborated to take on this challenge. We cast a broad net looking for solutions because we know, and this will shock you, that not all good ideas come from Frankfurt. I directed our team to beg, to borrow, to even steal any idea from across the country that was working, that could potentially change the trajectory of what we're seeing with this crisis here in the Commonwealth. Along the way, we hosted a youth focus group in collaboration with our fantastic partners in Kentucky Youth Advocates, KYOAAC. I got to spend significant time with several Kentucky high school students. We talked about, and I listened, did a lot more listening than talking about what we're seeing in communities across this Commonwealth, how we can reach these kids, and what messages would be more effective with their peers. I'll be honest, the time I spent with these students was one of the most informative and enjoyable I've had during my 9 months as your Attorney General. These young people were bright, they were well-spoken, they were driven to help their fellow Kentuckians. We had students from across the Commonwealth, but Dr. Roof, you'll be particularly pleased with the outstanding group from Taylor County. They talk about fire in the belly and passion for this mission and wanting to be of assistance to us. It would be hard for anyone to come away from this meeting without being inspired by the future of our Commonwealth. I say that despite the darkness that we face, that you face on a daily basis. So today, I'm here to present our proposal to build this prevention initiative. I'll outline our strategy and our goals over the next 2 years. I'll talk about the key partners who will bring their experience and expertise to the fight, and then leave the table and allow them to present and allow them to address your questions. Back when I sat here last time, I foreshadowed that there would be an ask of the commission, that I would ask for the commission to come alongside us and bring resources to help us save lives. So here I am to present to you our prevention effort, which is a three-legged stool. It's built from academic research, best marketing practices, and analysis of past prevention campaigns here in Kentucky and elsewhere. Focusing, though, on Kentucky's unique place in the drug crisis. We've consulted with national experts, local leaders, and again, young people. I'm confident we've built a proposal that will reach the young people with the right message, with the right messenger. At the heart of this initiative is a program called Better Without It. Better Without It. It's a youth-centered prevention campaign based on positive youth development principles. We know that young people simply won't respond to scare tactics or stern lectures. Folks dressed like me, pounding the podium. I'm a parent of teenagers. Believe me, I have plenty of personal experience with being ignored by young people on a daily basis, it seems. Better Without It will encourage young people to choose positive life choices. It'll shine a light on the resilience of these kids. It'll nurture what you'll hear more about in a moment. It will nurture the 5 C's: competence, confidence, connection, character, and compassion. Over a 2-year period, we'll launch an aggressive advertising campaign on social media, streaming services, with influencers, and at Kentucky's universities to show young people the totality of their drug-free potential. Their potential, Director. We'll tap into everything from name, image, and likeness, so-called NIL, to Instagram ads, anywhere we can reach young people who need to hear this life-saving message. From the mountains to the purchase, we will truly build a statewide effort to engage with youth from every population, urban to suburban to rural, in every part of Kentucky. This won't be some splashy cookie-cutter ad campaign. Every part of it will look and sound like Kentucky. We know these types of education campaigns can work. I'm sure that each of us will recall a campaign about cigarettes or drunk driving or seatbelt use that was impactful. As a result of these campaigns, of course, smoking is down, and Kentuckians now, as a matter of course, know to click it or risk a ticket. Let's be clear, this isn't a marketing campaign designed for me or for you. We may not even see these ads ourselves, and that's the point. While none of us are immune, we're not the group most at risk from this crisis. We know this. This initiative will be highly specialized and uniquely targeted on Kentucky's young people. We're going where the youth are with a message that will resonate with them. In a few moments, I'll introduce our partners who are helping to create this content. This team of youth prevention and creative marketing experts developed a similar program in Florida, where they've seen young people enthusiastically embrace the message. I think you'll be impressed by their passion as well as their experience in effectively doing this work. Throughout the campaign, we'll also convene a working group of young people, parents, prevention specialists, and of course, members of this commission to ensure that we remain targeted and focused. The Better Without It campaign will deliver this powerful message in a targeted, effective, and Kentucky-centric way. Now, the second leg of our proposal will promote school-based programs. Right now, there are a patchwork of existing school-based programs across our Commonwealth. They may look different and have a broad spectrum of components, but they all share a similar goal of promoting prevention and minimizing and mitigating risky behavior. Many of these efforts are already fully paid for and present no additional cost to schools. We need to do more. Along with our partners, Director, and members of the Commission, with the Cabinet for Health and Family Services, our team will help weave together this patchwork so that educators and administrators, principals, and leaders can turn to us for answers on how to easily access. They don't have time. We're going to make this as easy as possible to be a central nexus for them. We know young people are more likely to be influenced by their peers than someone who looks like me. Honest and productive conversations about the dangers of substance abuse amongst students can be a force multiplier. I'm convinced of that. The Attorney General's office will use our convening authority and our megaphone to connect schools with these proven programs. Finally, the third leg of the stool is to elevate and draw attention to the ongoing work of this commission and our partners in youth prevention. In this last grant cycle alone, the commission approved multiple awards totaling hundreds of thousands of dollars for school-based prevention efforts. You recognize tremendous work already ongoing in places like Anderson County, Scott County, and Taylor County. As we build a statewide prevention effort, we should continue highlighting these programs that you're already invested in and the Commission's role in funding them. Each of us in our respective jobs and churches and community groups have a platform to amplify their work. Whether through the Commission's website, speeches, social media, or in our everyday routines, we can help encourage these inspirational efforts. I plan to highlight them as often as possible, and I encourage each of you to join me in doing so. So those are the three legs of our stool. An innovative campaign to show young Kentuckians that they're better off without it, a full-throated promotion of existing school-based programs, and a consistent amplification of this Commission's partnership with youth prevention organizations. Together, those are three parts of the program that are carefully and thoughtfully designed to prevent addiction. But I'm asking you to help us fund, to help us resource this gold standard prevention initiative. I'm asking you to zealously collaborate with us so that we can reach young people where they are, to prevent them from taking their first, and in this environment, too oftentimes, their last experimentation with dope, with this poison. To do it, we need resources. You know the deep respect I have for the Commission's funds, which represent the shared pain of families across this Commonwealth. With this proposal, we can look to the future by investing a fraction of those resources. So today I'm asking the Commission to approve a 2-year, $3.6 million investment, an average of $1.8 million per year to stand up this prevention initiative. With over 1 million Kentuckians under the age of 18, 1 million Kentuckians in this red zone of risk, we will put, and I am committed to putting every dollar of this to good use in saving lives. Our parents and our grandparents schooled us that an ounce of prevention is worth a pound of cure. I believe this initiative lives up to that age-old wisdom. I don't buy the naysayers that paint a dim portrait of the caliber of these young people. I've met too many extraordinary sons and daughters of our Commonwealth who need this prevention effort. They face threats that were simply unimaginable to us growing up. They exist in an environment where there is no margin of error. So let's empower these young people to positive life choices and fulfill their potential. Let's go to them before they even consider walking down this dark path of addiction. Let's build Kentucky the prevention initiative that this Commonwealth deserves. I'm grateful for your consideration and your ongoing partnership. Now I'll turn over this table to our partners in this proposal who've experience in prevention efforts in other states to discuss this further. Then I'll be honored to answer any questions that you have today and, of course, at any time going forward.
Thank you, sir. give you a moment to get the text right.
Let's just make sure we get the screen share right. All right.
Thank you very much. And if you don't mind introducing yourself to the commission this morning or this afternoon, we'd appreciate it.
Thank you. Thank you, Commissioners, Attorney General. Thank you for having us here today. My name is Maria Bledsoe. I'm the Chief Executive Officer for Central Florida Cares.
Thank you again also for having us here. My name is Stanley Briz. I'm Executive Director of the Brevard Prevention Coalition in Central Florida, Florida Space Coast, also Chairperson of their Opioid Misuse Task Force.
Good afternoon. My name is Carolyn Capern. I'm a partner at CTS Agency. We were charged with implementing the Better Without It campaign.
My name is Greg Trujillo. I'm also a partner at CTS Agency. Thank you.
I don't know if this is going to go to presentation mode or not. All right.
We can see most of it.
Yeah, you can see.
All right, beginning.
Resume slideshow. There we go. Technology. You gotta love it.
We'll roll with it.
Yeah.
All right, Maria.
Okay. So again, thank you for having us here today and allowing us to share with you our Better Without It initiative. We're very excited to be here to present it to this commission and excited about making it a statewide initiative for Kentucky. Since our inception, Central Florida Cares prevention strategies have included, funding strategies have included prevention initiatives. I believe that addressing society's behavior is important upstream. Limit the experimentation, reduce risk, and save lives. We've been very fortunate in our community. We have some prevention coalitions, so I invited them to the office and asked them to create and develop a unique prevention initiative for our community that focused on youth and involved youth. The goal of the prevention initiative is engagement. That was one of my primary requests, focused directly on youth and young adults. Keep youth engaged both on and offline. Our community, since the rollout and the implementation of this initiative, has been just vastest excitement around our community, our stakeholders, our schools, and most importantly, our youth. At this time, I'm turning it over to Stanley Briz, who'll talk about the prevention principles.
Thank you, Maria. She's been a great partner in this. So the principles of this, as was mentioned earlier by the Attorney General, is based on positive youth development, the 5 C's. It goes beyond just saying no. And that is no disrespect to any previous campaigns. We know every effort works with our kids, but we're looking for what's going to truly impact them to the greatest degree. And so a big part of this campaign, based on those positive psychology and by extension positive youth development principles, are encouraging young people to make positive choices and realize their fullest potential. And as mentioned, the 5 C's are competence, confidence, connection, character, and compassion or caring. We found by doing that, it is linked to better academics performances, fewer missed classes, less trouble with authorities, less discipline referrals have also been seen in the schools, and them just realizing their fuller potential as a self-actualizing goal instead of something that being put upon them by authority figures. And so these are some sample outcomes from looking at how positive youth development was implemented, which is why it's such a fundamental component of this campaign. Among college students, it says here, using PYD as it's abbreviated, was negative associated with symptoms, anxiety, and depression, meaning those were reduced. We saw some studies as well also where they got into different mindfulness, more goal-oriented activities. Those increased, once again, through self-actualization. 4-H youth are nearly 4 times as likely to make contributions to their communities. And if you look into the positive youth development schema, so to speak, those 5 C's lead to community contributions being made by youth. That's a huge factor. That's like the sixth C, if there was one. Outdoor positive youth development programs are also associated with promoting empowerment, decision-making, and pro-social development. A big thing you'll see across the country now is resilience, because obviously substance misuse comes from somewhere. Yes, it's experimentation, but there's a coping factor no matter which socioeconomic background the youth comes from. So instilling them on the front end with resilience is something that is huge. So when those adversities come up in life, they go to something positive as their first coping mechanism and not something negative in substance misuse.
So how does all of this become a media campaign?
I'll turn it over to Carolyn and Greg for the application piece.
Thank you. Good afternoon, everyone. So Stanley and Maria and their colleagues from our local coalitions came to our team in early 2020 with the challenge of creating a youth-first prevention campaign, with the challenge of meeting this unique generation exactly where they are in a way that they will want to pay attention to. And so in order to do that properly and do it justice, we started with an academic literature review on prevention methodologies. Stanley and others introduced us to positive youth development theory as one of those, and that quickly became the anchor for our messaging strategy. We've since built it into pillars such as your mind is better without it, your body is better without it, your relationships are better without it, and your future is better without it. And that we have been able to turn into a variety of different messaging techniques that we'll go over in a minute. Knowing that Generation Z is a little bit different than past generations in terms of how they consume media, we next moved on to a detailed review of strategies that we're working not only in the cause-based arena, but also in general product marketing and other avenues that Gen Z is paying attention to. From there, we dove into how they see substance use, and we actually looked at social media content. We looked at forums, we looked at Reddit, we watched YouTube videos, digging into how they think in their own words about this. In addition, as the Attorney General mentioned, we thoroughly reviewed past prevention campaigns, analyzed them, analyzed the outcomes that are projected from them, and then built upon that even further with local surveys and focus groups with Gen Z in our community through our colleges and high schools, which is something that we would very much look forward to implementing here in collaboration with Kentucky youth advocates, and we have already begun conversations to accomplish that, and that we're very, very excited about. When we rolled out the media campaign, the emphasis was and continues to be digital first, because Gen Z, for the most part, was born with phones in their hands, and so they know how to find information more easily than most of us. So we built the campaign around social media platforms to begin with, built on it with advertising on the platforms themselves and on streaming services like Spotify, Hulu, and Roku. We created and nurtured influencer partnerships that have created really unique content opportunities. We were even able to put some of our videos on Bally Sports during Orlando Magic games in our community for further exposure. And we developed a mobile game in order to reach them online through that platform as well and start to introduce prevention principles in a gamified way. And that has proved to be very successful as well. I would be remiss, though, if I didn't note the impact on students that we've seen, shall we say, in real life. Not that our digital life isn't pretty real nowadays, but in local schools, Better Without It has actually moved from being just a media campaign to also being something that is adopted on campus. The Student Government Association actually came to us from Cocoa High School with the interest in creating a Better Without It Day to promote anti-vaping on campus. And it engaged over 150 students in positive activities that kept them engaged and active for several hours in the afternoon. And the program has also been implemented in other ways, including as a diversion program in Brevard Public Schools and a youth leadership program as well. So it's been I think for us as a marketing team, one of the most gratifying things that we've been able to work on is just seeing how students have responded to this firsthand.
So when we measure our impact, most marketing campaigns, they start with reach and impressions, and they really don't go deeper than that. For us, that is just the beginning. We like to see the interest that's growing through video views, follower growth, the reactions, especially when they're sharing things with their friends, when they're commenting, when they're submitting surveys and replying and downloading the game and actually playing through each level of the game and seeing how far they get. But really, it's we really enjoy when the advocacy starts, when they start advocating on our behalf for our message, when they're signing up for our content team so that they can review our content and tell us if it's going to work for their own peers. If they sign up for our advisory group, swag requests where they want to wear the brand around. And then unsolicited tags and mentions when they tag us because they're interested in what we're doing, and that shares it to their audience as well. These are what we feel is more successful on our campaign, is the engagement and advocacy once we get to these points. To date, because of that advocacy, we've reached well beyond our own community through shares and tagging and the young students advocating on our behalf, with over 500 million impressions in the United States, not just our local community. 15 million video views and almost 1 million social media reactions, comments, and shares. The engagement part that it really excites us is the survey response. Without further promoting a survey beyond the beginning of our research discovery, we've had over 240 unsolicited survey responses where they find our surveys on our website and fill them out. 25 youth signed up for our content and focus teams, over 6,000 mobile game downloads and playthroughs, and over 3,800 youth served in the community and school programs.
And I think one of the things, just to chime in, that excites us the most about this opportunity to partner with you all is that we believe we can go even deeper in measuring the success of this campaign. There are certainly outcomes happening locally that we are excited about, but that are difficult to measure on a regional level, that you have opportunity to measure on a state level. And so we're very excited to explore that further and very committed to providing this commission with real results for the investment in this campaign.
And one thing that we're extremely excited about is we've already started to partner with Kentucky Youth Advocates on creating a plan on how we're going to reach the youth here, how we're going to use production companies here so that way the videos, the content, the students are from Kentucky for Kentucky.
Mm-hmm. Yeah. And then add to that, that's the success of a campaign or an initiative. You have to have the buy-in from the audience that you're trying to reach. So nothing about them without them, definitely by them and for them. So that's key, and we're very happy to have that tied into our campaign and already the early connections with the Kentucky Youth Advocates.
So we're happy to answer any questions that you all have, but otherwise we will return the table to Attorney General Coleman.
Thank you very much.
I was happy to serve as an appetizer to the main course that you just saw in terms of the quality of the product. This is not something on its face that, admittedly, I was comfortable with. My default is to pound the podium and say, one pill can kill. My default is to be the prosecutor and the law enforcement officer. But it's not my default that is as effective as what we've seen. We still will move aggressively in terms of going after those that bring the poison in this community. We'll pull no punches there. And we'll still support, as this commission will support the treatment component. Finally, we're there in terms of beds. 5 years ago, we had a waiting list to get into acute care. But where we have failed is in prevention. Now, individual homes, parents, some are figuring out how to do it better than others. But as the Attorney General of this Commonwealth, I have a duty to serve the entire state. And it is the greatest threat to our families right now is this poison pouring into this Commonwealth. And we have to address this gaping hole. And what we've presented today in the 9 months that I have, after taking the oath, working with you, Director, and your team, is the best that we can bring forward to this commission as a steward of what is blood money, as a steward of this money, to then have an impact. So with that, happy, certainly enthusiastic to answer any questions that you may have, clarify. But this, of course, is not a one-off. The door to my office remains open to any member of this commission at any time.
Thank you, Attorney General Coleman. With that, I open up to questions or comments from the commission members. Ms. Purdy?
Yes, I have a couple of questions. I wanted to know a couple of questions. When you say youth, tell me what ages you start at and where the impact or breakdown is more important.
I'm gonna have them come up, but to tee that up, the demographic we're targeting is 13 to 26.
13, 26.
Correct, yeah.
Okay.
And the second part of your question? I'm sorry.
I want to know a little bit. I have a 19-year-old in college, which is that's an important age because they're transitioning. What are you doing about the cool factor, if you will? How do you deal with, or is there messaging on the cool factor and what kind of kids are coming into this kind of initiative, and what are some of the initial engagement and reactions and outcomes for that particular group who are concerned about their reputation and becoming who they are, which is very challenging at that age?
Well, I'll take the first part, and maybe Stanley will take the second.
Well, much cooler. I need to leave the table probably. That question.
So, to briefly answer, we are trying to make this cool, in essence. We actually paid a lot of attention in the Better Without It branding process to colors and styles that speak to this generation. We actually, for example, in the course of our research, discovered that there is such a color as Gen Z yellow. So we tapped into color schemes, into fonts, into overall aesthetics that are meant to interest them and make it not another, with all respect to previous programs, black and red, dark and gloomy, to give them something attractive, appealing, and lifestyle oriented to wear and promote. There are actually a staggering number of members of Gen Z who have made the choice already to be substance free and who celebrate that fact. And we try to give them something to be ambassadors for. Stanley, you want to tap in?
Absolutely. And so you do it by tapping into that culture, the zeitgeist, so to speak. So right now, everyone's wanting to be an influencer. They want people to like their lifestyle. They want to look and feel like they want other people to look and feel, so to speak. So what we're doing is tapping into that culture, or that subculture, so to speak, to really build out the campaign. But also, like I mentioned previously, using the youth to help create these. Because if we're the ones dictating it, as much as I'd like to think I still look young, they still say Mr. Briz, and so it can't be Mr. Briz telling them this is what you're going to do. It has to be them generating the content. We have seen in real life application the youths that you would not expect latch onto a campaign like this. Those who may have had some experimentation or may have had some discipline issues at school or what have you. And this comes back to the positive youth development principles, or those 5 C's. Once you take a youth like that and you give them something and say, we trust you to help build a message to speak to others because you have leadership qualities, you're just not using them in the most productive ways, you get so much more out of them. So that helps us check the cool factor box.
Any other questions, comments? Dr. Wenzel?
I mean, I'd just like to comment that I'm just enthusiastically supportive of your work in terms of working on positive youth development and socio-emotional factors, because we know those will have benefit beyond substance use. They'll have overall benefit in terms of health and, as you mentioned, success, ability to achieve their lifelong goals in their future. And so as a child and adolescent psychiatrist, I just want to commend the Attorney General for focusing on our young folks and addressing those needs early, and looking forward to supporting evidence-based interventions for our youth, and particularly youth-guided interventions. Very excited about that.
Thank you, Dr. Brenzel. Appreciate the kind words.
Representative Fugate.
Yes, thank you all. Attorney General, thank you and all of you for coming today. We know the age 13 to 26. Is this a statewide initiative or is it certain counties within the state? I know being from Southeast Kentucky, I just pulled up counties in Kentucky most affected by the opioid epidemic. And my district is Prairie, Breathitt, Owsley, and those three counties are not just in the state ranked in the top 10, but in the nation of top 10. So is this program going to reach out to the rural parts of, and I know there's problems all over Kentucky in the cities and the counties, but that's pretty alarming. And so I spent 22 years with the state police. The last 10 years was with the Hydro Drug Task Force. And so the drug world was my world for 10 years. That's all I done. And sadly, those same counties were ranked like that 15 years ago when I was a drug detective. Not much has changed. I really like the initiative because it focuses on young people who many are probably experimenting with things they shouldn't because of no dad in the home, lack of jobs, lack of opportunity. And I'm not making excuses for them, but I want to be part. I want to see something that makes it a better life for them in the mountains in rural Kentucky in total. So is it going to be in all of Kentucky or just parts of it?
Representative Fugate, first and foremost, thank you for your service, wearing that uniform and serving a particularly hard-hit section of the Commonwealth. I have a duty to serve 120 counties, and at the threshold in discussing what the solution would be, what the tactics would be with a director, one of the absolute mandates is that this would be a statewide prevention effort. When you travel to Kentucky now as someone who's elected statewide and you go to counties, and I'm from the West, you're from the East, you go to counties that you may be relatively new to, and you want to make sure, of course, you remind yourself who the state representative is, what the dominant industry might be, what the local paper is. And you know as well as I do that one of the data points now, when you look at a county and you're visiting a county, is what the overdose death rate was the previous year.
Right.
That's a lens we view our counties, and the area you serve has been particularly hard hit. I'd like for my colleagues here to talk about how they micro-target the importance of this effort. One, that it be statewide, but two, that it look and sound and feel and smell like the Commonwealth. So when they're talking about using social media influencers, those that worked in Central Florida are not going to work in West Kentucky or work in the mountains. And so I want them to speak to how enthusiastic they are and how they micro-target, how they look at from NASCAR influencers to looking at 4-H and FFA and hunting, and so that it look and smell like our Commonwealth, so that it saves lives in the counties that you represent. So I'll let them speak to that.
When we met Director Evans, that was one of the first things he asked us was, this looks like Florida, because of course our videos have palm trees in the background, some of them. So, and he said, that doesn't look like Kentucky. How might you make this look like Kentucky? And so we explained that we are very committed to using local creative partners, photographers, videographers, even artists, to really make this feel authentic. We know it's important in order to connect with youth for it to feel like it's coming from their home and that the people who are speaking to them understand them. And so we're already on the hunt for creative partners to work with here locally. And we, as he was saying, have the ability to even segment that by region. So we can look at different regions of Kentucky, interview and conduct surveys in order to find out what passions, what interests are most dominated in those areas, and match with influencers, creative people, and others in order to make even regional messages very specific. We'll also be able to use our ad targeting techniques to narrow in by geography. We can go down as far as zip code if we need to. on most platforms in order to make sure that we're reaching the right people with the right message.
And to add to that, also going out to the communities and getting those youth voices that live in those districts and areas and counties to see what they say resonates with them, and maybe utilizing some of those, obviously, to create some messages that resonate with the population.
And that means going to Taylor County and getting some of those talented folks, Dr. Roop or Ms. Kelly. It means going and partnering with Operation Unite and engaging with Unite clubs and getting some of those impactful speakers like you see at the Camp Unite graduation. That some of them, extraordinary stories. We're gonna utilize folks where they are, and what we haven't talked about, but I do want to emphasize, is partnership with particularly with the University of Kentucky and University of Louisville. When we talk about influencers that can have a statewide impact, go Cats! We're gonna partner with UK, and we're gonna partner with U of L so that we hit that pocket in and around Louisville as well, and so that we're partnering, we're doing creative. Now this. Leveraging, using your resources. NIL is expensive. There's a heavy lift in terms of resources, and that's why the numbers are what they are. We're doing things that have simply not been done before in a creative way.
Thank you. And when you do come to the mountains, I'd love to be in on the day where we go out and find people because I know our people. So
100%.
Thank you very much.
It's a deal.
Thank you. One of the things I want to make sure is Commissioner Kelly was one of the ones who also joined us during this conference, but those who are joining us virtually, is there any questions or comments from any of you online?
I just want to say this is really encouraging. I think the last meeting that we had, we kind of discussed some, prevention initiatives, and what's been shared here today is an initiative of empowerment. And Attorney General Coleman, I applaud you, and Director Evans for identifying this resource and helping it to come into fruition. And so it's really encouraging. And in fact, you mentioned Taylor County a couple times. They just agreed to launch the trait-based model prevention, which has within it, every student will be able to take their own trait assessment and archetype assessment. So that really is very, very cool. So we've got a lot of cool factor points already. And what we're hearing here today is just very much in agreement with what I think, what the research suggests, what the literature supports will be the most effective approach to prevention, and just helping students to better navigate difficult emotions, to better know who they are, and to better become self-aware. And so, I think this is a great initiative. So thank you all for the work you've put in.
Thank you, Dr.
I want to second that, and I want to thank General Coleman and his entire team, Chris, for working on this. I know you just took office in January, and it's incredible the speed of which you have hit the ground running, and you're to be commended for that. And I know from our many conversations that your heart is in prevention. I know you're the Attorney General, and law enforcement is so very important, and we know that and love what those ladies and gentlemen do. But we need to reach our kids. And I often think, God, I wish we would have been able to prevent 9/11. I really do. Would we have known the magnitude of what we were preventing? So when you think about preventing a child from dying of an overdose, becoming addicted to drugs, you prevent one, and it's generational change for many of these families. I've seen it in my own family, seen it in communities all across Eastern Kentucky. So thank you for putting your heart and soul into this. I want to express 100% support, and just know that we're here in any way that we can support you across Eastern Kentucky. I know you know the Congressman, Senator Markey calls him the Paul Revere of the opioid epidemic, and his heart and soul is in this as well, General. So thank you very much, and just know that we're in the shadows supporting you and cheering you on. And I'm Robert Stivers' appointee to the commission, which is an ex officio position. I don't have a vote, but I feel safe in saying I know where President Stivers is as well.
Commissioner, thank you. Congressman Rogers has been at the tip of the spear the absolute tip of the spear in creatively, innovatively trying to save lives. You look at the model of Unite, and it is reflected in that three-legged stool that I mentioned. This is one of those legs that outside of the district that he has served, we simply have dropped the ball. And so we're in our own way replicating and the use of technology, creatively attempting to replicate a statewide version to a degree of what he's done so well and served so well in Representative Fugate, you're the district you serve.
One last thing that I'll add is when I first started at Unite and we were drilling down into grassroots efforts in the community, I read The Tipping Point. I don't know if you read that book, but one thing I took away from it is if you can get 5% of the people in a community to be ready for change, then that ripple effect is magnified significantly and can really change things. But you need 5%. And if we can get that in our schools and college campuses, bring the cool factor like you've been talking about, and helping them understand not everybody uses drugs and alcohol, and the real dangers here. And again, letting them come up with the messages is brilliant. If we can just reach 5%, I think the students will do the rest on their own.
Thank you. Any other questions or comments from the members?
I could speak.
Oh.
General, you discounted yourself. I think you're pretty cool, in my view. But I appreciate the innovation and the creativity. And I think it's a great resource identification, as Dr. Root said. Look forward to working with you all. And kudos to you all for identifying this resource. Thank you.
Thank you, Commissioner Allen. You may not reflect the demographic we're shooting for here, but I appreciate the kind words.
Thank you. Seeing that there's no other questions at this time, I'm going to ask for a motion to vote on the request from the Attorney General to allocate $3.6 million to the prevention initiative detailed in today's presentation to the Commission. So I would ask for a motion on that.
I'll make a motion.
A second.
Motion move forward and seconded. All in favor?
Aye.
Any opposed? Any abstentions? The motion passes. Thank you very much, Attorney General. We appreciate your time here today and spending with us in promotion on the prevention program. So thank you very much, sir.
I'm deeply grateful for the time. Director Evans, thank you for your leadership and making this happen. I look forward to partnering with you as we seek to work with those that just sat on my left and my right and save lives.
Thank you very much, sir. And with that, we'll move forward. We have a couple of other pieces of administrative business that we need to take care of today. One, as I mentioned earlier, that there is a need for a commission meeting in October. Based on the commission's prioritization process from the last meeting, there is a need to discuss the commission's wishes and to make sure there's a little clarity. So we're looking to add a meeting in October. The date which had the least conflict was October 8th from 1 to 2 p.m. And so I'd like to have commissioners look to see if that is available. Again, we recognize that everybody will not be able to make it, but we are looking to see if that is going to be an option for folks, and I welcome any discussion about that date and time. Again, that would be October 8th from 1 o'clock to 2 o'clock p.m.
I can do that.
Okay. Any comments regarding the scheduling from anybody who is with us virtually? And again, we recognize that for some that this will be difficult to make, but okay.
Unfortunately, I'll be on an airplane chaperoning a trip of middle school students. So I am unable to make it on the 8th. Please pray for me.
1 hour. And thank you. We our best wishes are with you on your travels. With that, seeing that, I'm going to ask if I can get a motion for adding that date to our calendar. If I can get a motion from someone,
So moved.
and with the second,
Make a motion.
and I have a motion from Ms. Purdy, and we'll take a second from Mr. Allen. And with that, we will vote. All in favor?
Aye.
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 Any opposed? Any abstentions? All right, with that, the motion passes. With that, the next order of business we have is just to go through for the proposed 2025 meeting schedule. I believe this has been submitted to the group. All meetings will take place at the Capitol Annex at 702 Capitol Ave, Frankfort, Kentucky 40601, and they will be scheduled from 1 to 4 p.m. Eastern Time. The room will be announced when assigned for those meetings. The dates which are tentatively scheduled are January 14th, 2025, March 11th, 2025, May 13th, 2025, July 8th, 2025, September 9th, 2025, and November 4th, 2025. I would ask again for a motion to adopt these dates.
Make a motion.
Motion made by Mr. Allen, I believe seconded by Mr. Weber.
A second.
Okay. Thank you. I would ask at this time, all in favor?
Aye.
Aye.
Any opposed? Any abstentions? Okay, thank you. The motion passes. The next scheduled item is an opportunity for commission member announcements. So I open this opportunity for any announcements from any of the members of the commission that they'd like to make at this time.
Yeah, I'd like to tell everybody that September the 16th on the south lawn of the Capitol here, we'll be celebrating Recovery Month. The program will start about 10:30. We have, I think, over 75 vendors that are planning on being here, so it should be a big event.
Is it a morning?
Yeah, 10:30 a.m. On the 16th.
Thank you. Any other comments? Okay. Thank you. And with that, I see from staff that there is no one who has asked for public comments. And so with that, I will actually ask for to have a motion for adjournment.
So moved.
Dr. Brenzel, seconded by Director Ingram. Any discussion? All in favor? Any opposed? The motion passes. Thank you very much, everybody. We appreciate your time today.